good morning. I just went and saw room 6. She's a female who comes in today with a complaint of a headache she's had for about 2 to 3 weeks now. She describes it as a band or a vice around her head and rates it a 3 out of 10. She said it does occasionally get up to a 6 out of 10, and that's when she'll take either Tylenol or Motrin and drink more water. She works as a data analysis and said that work has been very stressful lately. And then her blood pressure has been a little elevated. It's 136 over 84, and and then I retook it and it was 140 over 90. The rest of her vital signs were within normal limits, and the rest of her physical exam was unremarkable. She did also complain about occasional neck stiffness as well associated with her headache. I did narrow it down to a tension headache or a migraine, and I'm also concerned about her elevated blood pressure. I think tension headache because she was describing it as a band around her head, and it's usually a mild pain. And she does have some stiff neck stiffness, and then she's also been really stressed out at work. And then migraine because she did rate said that her headache can get to a 6 out of 10, which seems a little high for a tension headache, but she does not have any visual changes. She does not have any like sound or light sensitivity associated with migraines. Um, and then she does have a family history of hypertension, but she said that she'd never had high blood pressure before, and this is the first time it's been elevated. So I'm not sure if it's a new diagnosis of hypertension or if this is associated with her headache. Um, so I that's kind of where I was going to come to you if I should consider this as a maybe a headache from hypertension, or if it'd be more like of a tension headache and how I could differentiate the two. But my plan is to have her try some lifestyle changes. I really encourage her to keep drinking water, to try some stress management, and then encourage a healthy diet with some exercises. She says she has gained some weight recently. So we talked about some diet and exercise changes and some suggestions that she could try just changing a little bits at a time. I've also encouraged her to try Tylenol instead of Motrin. The Motrin can increase her blood pressure. And then as far as her blood pressure, she does have access to a blood pressure cuff, so I encourage her to take her blood pressure and to make a follow-up appointment with her primary care. I would like to learn more about like headaches and hypertension and when to make that final call of calling it hypertension or just seeing that it's maybe an elevated blood pressure from her pain. And I'd like to learn more about kind of how to make that differential.